Hi, I'm Aisha 1Q and Mata is my #1 hospital. My encounter at Mata Hospital was actually so far my best because you see, when you enter the doctor's room, the doctor is just ready to listen, the doctor is warm, the doctor is kind.
We have a wide range of inpatient and outpatient services, including accidents and emergencies, offering services for both children and adults.
And I would wish young people could come here too so that they could feel how I felt. That's why I keep coming to Mata over and over and over. Their services, top notch.
Mata Misericordiae Hospital. You matter to us.
Well, it is Monday, the 3rd day of March. Very good morning to you, and thank you very much for joining us on Capuchin TV. And over 3.3 million Kenyans are living with diabetes, with many cases remaining undiagnosed. And according to recent statistics as well, 800 million plus people are still grappling with this disease worldwide, a fourfold increase from 1990. But what exactly is diabetes? What are the triggers? And is it possible for you to take control before it knocks you down? Well, this morning we break it all down. Fact from fiction, science from myth, right here on Capuchin TV on this show, Health Discourse. From the role of diet and insulin to the dangers of poor management. And we ask these tough questions as we get the responses from the expert. Joining me in this conversation is none other than Felix Okoth, who is a clinical pediatric nutritionist. I'd just like him to say hello before we delve into our conversation.
Good morning, and good morning to our viewers. It's a pleasure having you on this show, and stay tuned. You're going to learn much. Felix Okoth is a nutritionist. I work at Mata Hospital. And we try and handle different categories of people with different ailments: diabetes, cancer, gastritis issues, things to do with arthritis, things to do with gout, renal issues, pediatric issues to do with children feeding, poor to gain weight issues on adults and even children, among other lifestyle diseases. And also we do intensive care for patients who require ICU nutrition.
Absolutely, not forgetting the Mata iconic Mata Heart Run.
This month, on June.
In June.
Actually, it will be from June. Actually, it's May. From May 18th.
The campaign starts from May onwards.
Yes.
All right. And of course, as usual, we really care about you, and we involve you in the conversation. So if you are diabetic or you are caring for a diabetic patient, you've got any question, direct it to us. Use hashtag Sasha Elizabeth on X, Sasha Elizabeth on Facebook, and Okoth, that is Felix Okoth Nutritionist on Facebook, and Felix Okoth Oder1 on X. So off we start with our conversation. So weigh in on the conversation. Our number are on the screen, and I'd just like us to start with uncovering what exactly is this condition, diabetes, and why is it becoming a growing health concern, not just in our country but even globally.
So diabetes, I would say in simple layman's understanding or language, is that diabetes is a metabolic disorder. So in simple terms, metabolism is generally how your body uses energy that you get from food. So in a normal situation, you get that you eat, right, to give you energy to function. So the stomach tends to digest this food. So once the stomach digests this food, the part of food that gives us energy is the glucose in it. So what in simple terms people call the sugar. It's like sugar is from sugar cane. Glucose is also synthetically removed from food. So natural food also releases the energy called the glucose. So once this glucose goes through your bloodstream, it needs to leave your bloodstream to the cells to use it as energy. But it can't go on its own. So it requires another hormone called the insulin. So the insulin is an hormone that produced by an organ in the body near the stomach called the pancreas. So the pancreas secretes insulin with its main purpose to attach to the glucose that is produced from the food that is in the bloodstream and act as a transport, or in a simple term, as a key for the cells to take it in. So for people who have diabetes, they have inability of either the pancreas to produce sufficient insulin, or for the cells are unable to take the sugar. So in such instances, these sugars will, instead of going to the cells where they're needed, they remain more in the bloodstream where they're needed. So a diabetic person is just as an individual who has abnormality of sugar uptake with high sugar levels or abnormal sugar level within the bloodstream that should not be there, but instead should go to the cells. So that is what is diabetes, and it can be caused by so many things that we'll discuss as you continue.
Absolutely. Thank you very much for that detailed explanation. And swiftly, let's get to know what are the triggers of diabetes and who is at most risk.
Okay. So the triggers are, there's so many things that can trigger diabetes, and one of them is the genetical makeup of an individual. So there are some people who their genetics are made in such a way that it reaches a time whereby their cells are unable to take the sugar, or the uptake is just impaired at that time, depending on the genetic mechanism. And that's why when one has sugar issues, they are asked, is there anyone in your family who has ever had diabetes? To tend to connect this genetic mechanism, that will be a trigger. But apart from that, we also have factors that can trigger one becoming diabetes. Even hormonal imbalance can trigger one to become diabetes. And hormonal imbalance can occur due to different causes. Example, when a mother is pregnant, there are different hormones that chances of hormonal imbalance is very high. And one of them can be insulin that causes something called gestational diabetes. So when a mother's gestational diabetes are not controlled, this high energy level or high sugar levels within her bloodstream can still be passed through the umbilical cord to the baby. And that, because the energy is in the bloodstream. The same energy in the bloodstream is the same blood that goes to the baby. So that high glucose level can still impair the general mechanism of control of sugar of that child, and the child can become type 1 diabetes when the child is being born. Similarly to the mother, if that sugar is not controlled during pregnancy, they can later on become diabetes for life. But if it's well controlled, they can either change and the sugar can be controlled for life and they don't become diabetes. Apart from that, we have medical conditions that can trigger one to become diabetes. And mostly these are medical conditions that are related much to these organs that help in metabolism generally. And one of them is if the pancreas itself has a problem, whereby we have a condition called pancreatitis, which is inflammation of the pancreas, or other condition that can affect the pancreas, chances of it producing enough insulin can be a problem, leading to the diabetes. Apart from that, issues of the liver or the gallbladder, if not controlled, can still impair the normal body metabolism and cause this condition, diabetes, and among other conditions. Apart from that, we also have the obesity. Obesity can trigger diabetes. And how can obesity trigger diabetes? The more heavier you are, the more also hormonal imbalance, which one hormone is called estrogen. The higher estrogen levels, which can also imbalance insulin production. So obesity also, for you to become obese, high energy intake that can affect the pancreas and control of insulin. Apart from that, medication, steroids among other medications, can also cause one to have diabetes. Or as I said again, imbalance hormones, stress, among other hormones, among other causes can cause one to be diabetes.
All right, briefly, is age a factor when it comes to those who are more susceptible to diabetes?
Age can become a factor, and age, I would say, it becomes a factor depending on the type of diabetes the individual is going to get. We have two types of diabetes. We have type 1 and type 2 diabetes. In type 1, it's called insulin-dependence diabetes mellitus. Insulin dependence because at type 1, this person's pancreas is like a shutdown. There is no or less uptake of the sugar. So when the pancreas is impaired, it can't produce insulin. So what will happen, you have to depend on insulin from outer source. So mostly this gets teenagers and people below, let's say, 30 years of age, 31. So age depends on the type of diabetes. The type 2 diabetes is mostly people above 30, 40 years and above. And this is depending on the age of an individual, how the organs have been worked, the lifestyle of this individual, among other causes. So yes, age determines, but the type really becomes different.
Yeah, because I remember growing up, there was, I think it should pass as part of the myth that needs really to be busted or debunked, that diabetes only affects the elderly, the octogenarians onwards. But right now we see even children suffering from these metabolic disorders. All right, so the warning signs, what should one watch out for, and when is the right time to seek medical advice?
I would say the warning sign depends, those are what we call the symptoms. It depends with the sugar levels within an individual system. So the symptoms are much different depending when the sugar levels are low or when they're high. So in a layman understanding, it's like when you put salt in meat, right? When you put salt in meat, it tends to dry off the water, right? So similarly, when you have high blood sugar, the sugar level is not controlled, it will draw water from your cells. And when water is drawn from your cells, the cells will remain without water. So one of the symptoms, dry skin, dry and itchy skin. Another thing you can also have, because water is drawn away from the cells, frequent thirst, dry mouth, okay? Now there is this too much accumulation of water within your system, the body is trying to release them out, frequent urination as another sign. This water is drawn out from your system, you have talked of frequent thirst, dry mouth, you have talked of frequent urination. This sugar level is high within your bloodstream. So what will happen within your bloodstream? There is irritation of your nerves and all that. So some people can have hot flashes on their legs. Mtu anasema mguu inadunga or something is pricking my legs. Apart from that, because it's also, the sugar goes through all the nerves within your system, even the highs of the nerves. So the sugar tends to irritate the nerves within your eyes and causes protein leakage to the pupil or the retina that affects the vision. So they also have blurry vision, okay? So apart from that, because the sugar levels is high in the bloodstream and not getting into the cell where it's needed, the body is not getting enough energy. So what is happening? This person have just taken a lunch. After 10 minutes, they're feeling hungry. So frequent hunger, because the sugar level should not go to the cells and the brain is still communicating to the body, I've not gotten anything. So they don't get satisfied. Apart from the frequent hunger, remember I said insulin is an hormone. So with inability of controlling the blood sugar, it can also imbalance other hormones. So these people can tend to be hungry. There is anger ya nja and anger ya hasira. So they are easily irritated. So we've said bloody vision, frequent hunger, frequent urination, frequent thirst, okay, among others. Now, when the blood sugar is low, there is again a different symptoms, because when the blood sugar is low, the body is not able to get enough energy. So frequent hunger again. The difference between hunger when the sugar levels are high and when the sugar levels are low is that when it's low, you have not eaten, you have taken a longer time without eating. But the hunger when it's high is that you're not getting satisfied. Immediately you eat, you feel hungry. So frequent hunger, fatigue, because the body doesn't have energy. When you're fatigued, every single organ of the body will try to use the insufficient energy that is there. So palpitations can occur. Apart from that, dizziness can occur. And in general body weakness, headaches, you can have headaches. And apart from that, drowsiness can also occur. And apart from that, in our rare, serious circumstances, someone can become unconscious and you faint. So the symptoms depend on the level of blood sugar. But if you have any of the symptoms, the most important thing is checkup. And that's why at MATA we have Wellman's Clinic. And in Wellman's Clinic, we always check you generally your blood pressure, your blood sugar, because when you check your blood sugar, there is a level that it will tell you. Let's say I have a blood sugar machine. I can show you later on when we have time. I'll check my blood sugar, because a normal blood sugar should be between 3.5 to the highest 7.0. But 7.0, if it is there also oftenly, you should check yourself, because averagely should be 3.5, 6.5. When your sugar is above 6.5 most of the time, that's when we call it pre-diabetes, from 6.5 to 7.5.
What if I consume something that is sugary in the morning? Will that give altered results?
Yes, it will alter result, because you've taken something with energy. That energy is still getting through your blood system. And we remember, where are we going to check the sugar is in the bloodstream. And that's why we tend to advise, if you want to get the right amount of blood sugar, check your sugar levels in the morning. And in the morning we say it's fasting blood sugar, because you have taken a longer time before eating. 3.5, 6.5.
Great.
If you have to check during the day, like you have said, it's called random blood sugar. It's important you check it 2 hours after you have taken something. And as long as it's between 4 to 8 or 3.5, 7.0, we are good to go.
Quite interesting. Now, what is the interplay? I think I hope our director will let us know, so we can spare 2 minutes, 3 minutes are enough to do the demonstration.
Yes.
Great. And what is the interplay between diabetes and nutrition?
So the interplay is that, remember, diabetes, we have said, is a metabolic disorder. The work of the pancreas is to help in uptake of sugar from food which is in the bloodstream. So where is the sugar coming from? It is from the diet. So no matter the best drug that you have, if you're not able to control the diet where the sugar is coming from, you will not be able to control the sugar, because there is no specific dose, as this dose will help you to control your sugar for a lifestyle. The dosage are titrated depending on the sugar level at that time. So what is affecting the sugar level is the diet. So if you are unable to control the diet where the sugar level comes from, then it will be difficult for you to normalize the blood sugar. And that's why we said managing blood sugar depends on 3 main things. It is the diet, where the sugar is coming from, and that is on your meal portion and the type of food. Something we call check foods which have glycemic index which are low. Avoid those foods that have high glycemic index. So once you check on the diet, the portion, the meal timing, then also you need to adhere to your instruction of medication, either insulin or oral medication, which we can discuss later. Adhere to your medication, then exercise, because the medication now help in production of insulin or help in the cells to uptake the insulin. Then the diet prevent more sugar from coming in. Then the exercise help you use that excessive energy that will be within the bloodstream and also make the cells active to uptake the sugar. So 3 of them are very important, but diet plays a major role in control of the sugar.
Great. Is this condition manageable, and what does effective control look like?
Good. So diabetic is really manageable. And like I say, it's really manageable. When you are type 1, pancreas is not able to function, you'll be given insulin injection. You won't be given the oral medication. But when you are type 2, let's say we check on something called HbA1c. HbA1c is average blood sugar within how the cells are able to take your blood sugar averagely for the last 3 months, which will be, when they check the blood, it's measured in percentage. That's what signifies you how badly is your sugar levels and what should you adhere to in terms of management. So a normal HbA1c should also be 3.5 to 7.0, the previous documentation, but now it should be below 6.5. So if the HbA1c is above 15, then the doctor will have no option to give you insulin, because at that level, the oral medication will not be able to control it. And that's why those who working with HbA1c above 15 with the same medication, you need to go for a checkup, okay? And then if the sugar levels, we are able to use the medication, we're able to use the diet, and the sugar level is mostly below 7 or below 6.5, then we say you are manageable because your sugar levels is normal. So yes, diabetes is manageable, but with medication and diet and exercise.
So what exactly is the desideratum between oral medications approach and the insulin approach? So
the oral insulin, like I said, it's indicated for control of blood sugar, that we see, let's say this, when the cells are not able to take blood sugar adequately, and mostly insulin is given to type 1. But even type 2 diabetes, they are normally started on oral medication. That is, if the HbA1c is not high. Remember, a patient can come in, or you go to the hospital like now, they check your sugars, they find your sugars at 23. right? Or 20 or 17. Remember, 17 is higher than the 3.57.0 that I was saying. So at that time, when you're given oral medication, they might not really be active to lower your blood sugar within that faster rate as expected. So what will happen in such a scenario? You'll be put on, let's say, drip, some fluid drip, to wash away the sugar levels that are already accumulating within your bloodstream, not to affect your organs such as the kidney, and also be inserted insulin as you get monitored. And after an hour or two, when they check your sugars, when they normalize, then the doctor might decide to discharge you on oral medication. But after that therapy, and the sugar levels is still 15, 16, the doctor will decide to discharge you on insulin, because at that point, the dosage of the oral will be less active to control your sugars. So what indicates your sugar levels? One is the amount of your blood sugar. Another two, the age factor also matters, and the other complications that you have. Let's say you already have high blood pressure, you already have kidney issues, and your sugar level is above 11, 15, then the doctor will have no option but to give you insulin, because if they leave you unmonitored with oral medication, chances of the sugars affecting your organ further is very high. So the complication, then the HB1C, or the amount of your sugars, indicates what type of management are we going to see or to give you. And that's why you get at times someone is admitted, given insulin for like 1 week, then discharge on oral medication if the sugar levels are a bit within the normal range of management.
Thank you. Allow me to take some questions here. I think Fifi Amushi is following. Thank you, Fifi. We have Mary, who's from Ruiru. She's asking, what is she supposed to eat? That's in Swahili. Nafaa kukula chakula gani ili kuepuka hatari? Na mtu ambaye hana ugonjwa anafaa kula nini kuzuia kupata ugonjwa huu?
Okay. Sijui ni mjibu kwa Kiswahili ama Kiingereza? Lugha gani? Which one?
Maybe kwa Kiswahili, kwa sababu ameuliza swali kwa Kiswahili.
Cha muhimu kujua kwamba ni mtu yoyote anaweza pata ugonjwa wa sukari.
Ndiyo.
Na kama si ile genetics tumesema, basi kila mtu anapaswa kuangalia lishe bora ama lifestyle generally, kwa sababu kile ambacho unakukula ndio itapatiana ama italeta udhaifu kwa zile cells zako na kwa pancreas. Na aswa ni chakula ambazo zinapatia mwili nguvu, which ya kwanza ni sukari. Jaribu sana uzuie ama uzingatie chakula iliyo na sukari kwa kiwango kidogo sana. Kwa kivitu kama keki, ice cream, masoda, majuisi, jaribu sana uyazuie, kwa sababu kwa sukari kuna kitu tunaita glycemic index. Glycemic index ni kiwango ambayo ukila kitu jinsi ambayo utapandisha sukari yako kwa muda fulani. Kuna yale aina ya chakula ambayo ukiyala ama ukiyakula yanapandisha sukari kwa muda chache sana. Hiyo tunaweza sema iko na high glycemic index. Yanapandisha sukari kwa haraka. Na aina ya chakula ni nini? Chochote ile na sukari, keki, hiyo sukari yenyewe, sweet, juice. Kwa sababu ukinywa juice ama soda, haifai kushagwa, inaingia tu pap bila kushagwa. Na hii jinsi ilivyoingia pia itafanya kazi ngumu, ama itapea pancreas yako kazi ngumu. Na muda inapoenda, unapotumia haya vitu ya sukari, ile pancreas yako itakuwa na udhaifu fulani, na itakosa kufanya kazi inavyofaa, na ilete shida ya sukari. Pia kwa wale wanakula ugali mlima, chapati 4 kwa siku, slice 4 za mkate, unakula chakula kingi kwa wakati mmoja kuliko ile ambayo unafaa kutumia kufanya kazi. So ni muhimu kidogo kidogo mara mingi kuliko mingi mara moja, kwa sababu ukikula mingi mara moja itashagwa haraka na itatoa sukari kwa haraka. Basi kwa mtu aliye na shida ya sukari, ya kwanza unafaa kuzuia yale chakula ambayo yanapandisha sukari haraka, yenye tumetaja hizo vitu za sukari. Usiukule, na ukule ile siku nakukubalia ukule, ni ile siku utaona Yesu na macho. So usipoona Yesu na macho, usikule hayo chakula ya vitu ya sukari. Then angalia kiwango ya chakula yako, sana sana asua carbohydrates, ile chakula ambayo inapatia mwili nguvu. Na tumaini tutadiscuss hapo mbele. Na in a layman's understanding tunasema ukipakua kwa sahani, nusu ya sahani ikuwe mboga kwa sababu mboga hayaongezi sukari, lakini mboga yana yale mishipa ambayo yatazuia chakula kushagwa kwa haraka na atafanya pia ushibe. Nusu ya sahani kuwe mboga, alafu mara mingi wanasema quarter plate, lakini mimi husema 20%, 50% kuwe mboga, 20% kuwe carbohydrate, ugali, mchele na hayo mengineo, na 30% kuwe protein. Hiyo ni plate.
Okay, thank you. I think Mary umepata ujumbe pale na zaidi our brothers and sisters from Western Kenya and Nyanza, part of Nyanza, you know corn is very important. Sasa
Yes.
mtu lazima mlima ugali saa 11 alfajiri. Anyway, thank you. Now, I think Mary had somehow echoed what was supposed to be our next question of an ideal diabetic-friendly meal, and I think you brought it quite well.
I can still discuss it.
That's okay. So, the price of poor control, what are the long-term complications if blood sugar levels remain uncontrolled? And especially considering that in the preambles, according to research, is that some of these cases are not diagnosed early.
Some of these cases are not diagnosed early, and that's why we tend to advise every single person, at least after every 3 months, go for a general checkup. It's important for you. Prevention is better than cure. Now, like, what are the complications? When the blood sugar is high, we said it tends to irritate the nerves, okay? So when it irritates the nerves tend to be irritated, they fail to function, blood circulation becomes a problem. We have something called diabetic neuropathy. When the neurons are affected, the cells on your nerves can start dying and can even cause diabetic issues of the wound of the leg, poor circulation. And that's why every diabetic patient should always check on their inaitwa palm, or this is the heel, upper chini. Check with the mirror. If you see the color change of darkness, if you see a color change down there that is darkness, it shows poor blood circulation. That can cause those cells to die, and then you start having diabetic wound, and then we cut off that leg because those cells have died that we can't even help. So apart from neuropathy, we said it tends to irritate the eyes, and when the irritation of the eye due to the long-term blood division and irritation, there is a protein leakage on the eye that later on can affect the vision and cause blindness as a complication. Another thing, due to that high blood sugar and the sugar levels also goes to the kidney, it tends to irritate the nephrons or the nerves of your kidneys that can lead to poor filtration of blood that cause kidney issues. Acute kidney injury can lead to kidney disease. So the kidney disease, the nerve disease, the eye disease that we have talked about, and apart from that, diabetes neuropathy I've talked about, retinopathy, diabetes nephropathy of the kidneys. We can also have issues of the male issues, okay, where they fail to function. Erectile dysfunction in male can also occur because of poor circulation of blood. And apart from that, among other issues can occur whereby someone can become hypertensive because when the nerves are affected, poor circulation of blood tend to cause the heart to beat extra hard. That can cause hypertension. That can cause other issues, heart condition with poor blood pressure, among other conditions that can occur. So complications are very many, and that's why monitoring and making sure that your sugar levels within the normal range and well controlled is very important.
Thank you very much for that. There's Jacqueline Siombua who is in Machakos. I think the question she's asking is on whether at some point she can stop taking the prescribed drugs. Under what circumstances, if this is palpable?
I will say under documented science research, there is nowhere it's documented that a diabetic person can stop their medication. Because it's a once the metabolism is disordered, it's difficult to get it back to normal. But we have seen people tending, like we said, is the diabetic manageable? Yes, an individual with the proper diet, proper lifestyle, can be able to manage their sugar. At the beginning, they can use medication, but this is not documented in any research. I would say this is much of experience and work, okay? So individual can be able to control their sugar until they be within the normal range. But you cannot avoid now medication for life. But the only thing you can do, you can be monitoring your blood sugar, whereby we said if the sugar levels is below 6.5, the HbA1c that I said, that is the only place one can juggle between medication and diet and lifestyle control, but you keep on monitoring your blood sugar with the machine on a daily basis. If you see the sugars have started surpassing the normal range that we said is 7, then you take your medication. But the normal general advice is do not avoid your medication if you are diabetes unless the doctor titrate your medication downward, which yes, the insulin can be titrated from 30 to 15 or to 12, depending on how sugar is manageable, from 2-3 doses during the day to 1 dose at night, depending on how you are able to take your manage your sugars, from insulin and oral medication to the doctor removing the insulin and you remaining with the medication alone, from 2 doses of medication morning and evening to 1 dosage at night, depending on how you control your sugar. But I can't advise you to avoid your medication completely because there is no documentation on science on that, but we can see how we manage it together for the sugar levels to be normal.
Thank you. Most importantly, with the advancement in technology, there's an increasing self-diagnosis and uptake of maybe over-the-counter or meet-in-dawa, quote-unquote, or herbals to manage such chronic illnesses. What's your take about that?
My take is not even the insulin, not even the oral medication of diabetes should be over-the-counter, because you see diabetes can come with different complications. And the dosage in generally are normally given by your diabetic physician or diabetologist. So I would advise if you have diabetes, do not go over the counter medication unless you are going to fill the medication that you are prescribed earlier. But if it is after 3 months, you have taken the same medication for after 3 months, you should go for a review instead of using the medication over and over because maybe your sugar levels have changed. Now on herbal medications generally do not cure or do not treat, but they tend to help the body function. So herbal generally do not treat diabetes, but they can help to improve the metabolism, the uptake, but they will not cure. Okay, so example, let's say I said what will make our sugar rise is the carbohydrate, and then someone decide now I'm not going to take carbohydrate, I'll just do vegetable and protein. Trust you me, your sugar levels will still be uncontrolled, will still be having an issue because even the body stores glucose. When you don't give it glucose, it will release excess of it from the liver back to the bloodstream that can still impair your blood sugar. So herbal medication do not cure diabetes. So yes, you can take, but be very cautious because they can still affect other organs because they have some impurities that can still affect your body. So be sure, where is the source of your herbal medication? Is the component scientifically researched? And is it approved by the Food Drug Administration or our Ministry of Health and everything? So that you just don't take what you don't know that can harm your health, but they don't cure diabetes.
Thank you. And our time is really running out so fast, but we wish to know how a glucometer works and what's the right way to check your blood sugar levels at home. And at this point, our guest, the nutritionist, Felix Okoth, will just do a brief demonstration just to show you how you can do it because, you know, currently there are so many advancements and improvements in the medical field. I know apart from the self-test kits for HIV, there's one for DNA test, I think, if I'm not wrong. We have now here blood sugar levels, how you can check. So where can one get all these tools
So
for?
there are different machines or different glucometers of diabetic monitoring. So the efficacy is much on what the glucometers does, and the glucometers generally shows the sugar levels, and what makes them different, some have different levels. They can show you whether your sugars are low when your sugars are high, coded. Some can pair with your phone. Some can also be used on your hand, just generally implanted. So the difference of machine is much of that. And the other one is much on the strip. The strip, the difference is much on the reagent. The strip is where you put the blood. The reagent is how that strip is made. Some are made with something called oxygen dehydrogenase, meaning when you expose them on air, they can't react to the moisture to affect your sugar levels. That is the main difference. So the strips, yes, we have the strips at Mater Hospital. At our pharmacy, you can get them at a very affordable price, or you can come to our nutrition clinic at Mater Hospital, and we can tell you, we can prescribe it for you and get it through our pharmacy. So we have different ranges of machine depending on your on your money, because they also differ with the price. So like this one I'm using is a different one. I don't want to market them, but I just want to show you how to use it. So this is the strip generally, this is the machine. Now different machine also come with something we call the prickers, to make it easier for you to prick yourself, okay? Because sometimes pricking yourself, some people fear so much.
I'm one of those
Yes,
people.
so when you fear needle, this make it easier for you. So one thing you just do, most of machines have pens like this. So you just hold, in most of them is just pull. When you pull, in almost all of them, you insert the needle. The needles are different depending on the pen. Then all of them, you just twist the top of the needle to open the needle. And the ones you pull, you twist, you pull. Once you pull that, then you insert. When you insert, almost all those pens have this like kitu where it shows you can close. You see, like if I see this knob here and this knob here is much similar. So if I put like this, it won't close, but if I put them adjacent to each other, they will close. Almost all the pens have the coded numbers. The coded numbers are for the depth of the skin. So for like a child, because even children, when even a 1-month-old baby, 1-week-old baby can be diabetes. So this ranges, if it's the baby is 1 week, I can just put under one. Because them, they are not pierced on the hands, but at times we pierce on the heel or upper nyuma, but others on the hands. So 4, the higher limit at 4 is like wale watu wa mjengo ama skin is so tough, you see. But if you have a soft skin, just 3.5 or 4 is okay. So once you twist that, for this one you pull, okay? Once you pull, it's ready for injection. For injection, you just prick there, okay? So once I pull, then I can now insert my strip. The disadvantage of inserting the strip earlier is that it can go off, and then when you put blood, it shows you an error. So I'll insert this one. You see, it shows me I should insert this way. Most strips shows where and how you should insert. So once I insert, the machine just becomes on its own. So when it becomes on, it beeps. It asks me for blood. Then it's ready for me to inject. So for me to put blood, I'll just wipe my thumb or any finger on the top side. Then I just prick. Once I prick, I'll press a little bit of the blood. And once I press the blood, I'll just take the strip and put it on the blood there. And within a second, the sugar will be measured. We say the normal blood sugar, we are targeting 3.5, 6.5. So if you get my sugar is above 6.5, I've not seen it, I am pre-diabetic. If it is below 3.0, sijakunywa chai, which I have not, was rushing. So that is very normal. So my sugar is very normal. So that's very nice. So that's very normal. So let's say if my sugars were high at 13, I'm already a diabetic. Now I should inject insulin. So this is a dummy to show the tummy, okay? So for insulin injection, this is the kitovu. You should inject 2 centimeters away from the tummy, this side, and 2 centimeters away. So you can inject the tummy, we can inject this is the thighs or the arm. But this is more useful when someone is helping you. So an individual is either here on the thighs or the tummy, but tummy is very, I tend to advise my patient to use the tummy more because it's away from the muscles and it has a larger surface area that can use over time and over time. So when you're injecting the insulin, once you are 2 centimeters away, always try to rotate. So we divide the stomach in quadrants so that we avoid injecting same place every time. It causes something called atrophy, where the cells around that area start dying and can affect the muscles and all that. So we keep rotating. So you inject here, the next time here, the next time here, the next time here, you keep rotating. So let's say this is the insulin pen. I'm trying to be a bit brief. So yes. So this is the insulin inside here. The insulin is like a water in nature, okay? So normally if the doctor say 10 units, you just round it to 10. You'll be able to see, and it will normally have the clicks which you can hear when you are doing. So this is the needle again This, not that one, sorry, a minute. This is the needle for the injection. So this is how the needles
So
looks
that's,
like.
yeah, that's
This is
the
insulin.
effective, the best way to administer insulin
Yes.
for maximum effectiveness.
Yes. So insulin, the ones you are using can just stay on a room temperature hata kwa koti, but the ones you are not using, you should refrigerate them pale kwa mlango. Okay? Then when you remove them, because they are cold, you can just give it to them. You just do like this, rub like 1, 2, up to 10. Then thereafter, you'll put the needle. So putting the needle, you just cap it up. Once you cap it up, and then we remove, then there is our needle. So I had measured the unit the doctor said, which is 10. If the doctor says 15 in the evening, you'll also measure. So if you can see, if I press, sorry, you'll see that. That is insulin coming out. The 10 unit, it will go, sorry, I'm making it is clean though.
No.
So it go up to 0 and that's it. So if I put 10 units and I inject, don't inject when insulin is slanted, because it need to reach the subcutaneous part of the skin. So make it straight at 90 degrees and then inject, then release. It goes up to 0. Once it's 0, count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 for 2 seconds to avoid spillage of insulin. And we are just done like that. The next time again, on this other side of stomach, you inject. Now, why do people normally hold like this? So that just to reach the subcutaneous. But for some insulin, it depends with the gauge of the insulin and the length. Some are not enough, a must, like the 3 unit gauges.
Okay.
And that's it.
Thank you very much, Felix Okoth. I think our time is up, but we really appreciate you. Just in 2 seconds, just to give your parting shot.
Yes, so my parting shot is there is well-detailed diet that we tend to educate our clients. And nowadays diet, we don't do the plate model only. We don't do the underlive level whereby unaambiwa ugali ni hii. With us, we teach you diabetes in terms of the carbohydrate content in food and the sugar level, so unit that it will produce in terms of bread and all that, how much sugar will it raise and all that. So you can get me at Mater Hostel. We have a diabetic clinic there that will be able to take you through, make for you a tailor-made individual diet plan. And then Atran is coming. Please help us support children in that condition. And I was just checking on my phone the specific date. Sorry for taking your time.
It's okay.
So the specific date for Atran will be on a minute.
Meanwhile, watu wa mjengo and ugali lovers, there's no hard feelings intended.
Yes. So Atran will happen at 31st May 2025. In Nairobi, we'll have Atran in Ulinzi Sport Grounds Complex. Mombasa will be Loreto Convent, Mombasa. Kakamega, Bishop Sulemeti Girls. Nakuru Athletic Club. Kericho Teachers College. Kisumu, Jaramogi Oginga Odinga Sports Ground. Bomet, St. Mary's Day Boarding Primary. Nyeri, Dedan Kimathi University Technology. Eldoret, Moi Girls. Machakos Schools. Kindly purchase a t-shirt is 1,000 bob, or inquire through Mater website. They will advise you on what to do, and we really appreciate you. Thank you so much.
Absolutely. Thank you very much for your time, Felix Okoth. We wish to do this more often because clearly there's quite a lot to learn about nutrition and diabetes. And of course, diabetes isn't just a life sentence. It's not a life sentence, but it does require discipline, knowledge, and the right choices. Managing it isn't just about medicine. It's about lifestyle. It's about nutrition. It's about regular checkups, as you've heard from the nutritionist. But remember, your health is in your hands. So at this juncture, I'd like to wrap up. Join us next time as we continue to unpack the health topics that matter most just here on Health Discourse. So until then, stay informed, stay healthy, and take charge of your well-being. Behind the scenes, I had Mavaton Charles, we had Father Lawrence here, and on the other side of the chambers, we had Peter Mwangi, Eric Otieno. So for all those who participated in planning this, especially Mater Hospital's team led by Eric Muter, thank you very much and God bless you. My name is Sasha Elizabeth. See you when you see me. Goodbye.
My name is Jemima Kaigongi. I'm expecting my first baby. The Mater Hospital is my hospital. It's where I normally attend my clinics. They have very nice, good services, and they look deep in your well-being.
At Mater Hospital, we have a wide range of inpatient and outpatient services, including accidents and emergencies, offering services for both children and adults.
The journey with the gynecologist has been very good, and with Mater Hospital, there is nothing to be afraid of, especially when you are expectant.
Visit our website or any of our medical centers across the country. Mater Misericordiae Hospital. You matter to us.